Through briefings and debriefings, Baylor Scott & White's surgical safety checklist has been modified several times to be standardized and efficient while focusing on the patient. Every operating room has a poster-sized checklist on the wall to utilize during the timeout. All incoming and current staff are required to complete a surgical safety simulation checkoff. This video will describe how continuous communication among team members during a case utilizing a surgical safety checklist will decrease mortality and complication rates perioperatively. While preparing for the case, the nurse speaks with the surgeon and confirms the patient's name, date of birth, MRN, and the procedure being performed. The nurse also confirms that an history and physical and an interval history and physical note are completed. They also review diagnostic and radiologic tests and how much blood loss is anticipated. This information is relayed to the rest of the team. As the patient comes into the OR, anesthesia confirms the patient's identity with 2 identifiers and the patient's allergies. The anesthesia provider confirms with the nurse the difficulty of the airway and risk for aspiration. If appropriate, antibiotics are started at this time. Once the patient is draped and all staff are able to stop what they're doing, the timeout is performed. Team members introduce themselves and confirm the patient's identity with 2 identifiers, the procedure, incision site, and if the site is marked and visible. Equipment concerns are addressed, and the surgeon states critical or non-routine steps, the duration of the case, and any anticipated blood loss. The tech and circulating nurse confirm sterilization, as well as the initial count. Anesthesia confirms that the antibiotic has been given within the last 60 minutes of incision, any beta blockers, and VTE prophylaxis, as well as normothermia measures are being implemented. Prior to skin closure, the nurse confirms with the surgeon and anesthesia that counts are correct, the wound classification, any specimens that were collected, and equipment problems that need to be addressed. Key concerns for recovery and management of the patient are also addressed. As healthcare professionals, we strive to put our patients' best interests above all else. Briefings and debriefings allow us to improve our patient caring skills and learn how to fix our imperfections.